glad to be here. Welcome.
Thank you very much. I will quickly move to Brian Ajiko. Please go ahead.
Hello, good evening, everybody. My name is Brian Ajiko, representing St. Francis Community Hospital.
Thank you very much. I will now move to Mr. Thomas Rotich. Please go ahead.
Good evening, everyone. My name is Thomas Rotich from Moi Teaching and Referral Hospital. I'm grateful to be here tonight. Welcome.
Thank you very much. I will now move to Dr. Kibet Shikuku. Please go ahead.
Yeah, thank you. Good evening, colleagues. Welcome to this discussion this evening. I look forward to, sharing whatever we have as regards, blood management and the various systems and softwares that can be used within our country. Thank you.
Thank you very much, Dr. Kibet. Very quickly, we will move into the next session. And this session is to give a brief presentation on what Damu Sasa is, especially for those hearing it for the first time. After that session, we will have the panelists each talk about a specific area in the blood services management process, and then we can have a question and answer session immediately after that. So very quickly, let me do a quick presentation on what Damu Sasa is. So the main objective of Damu Sasa is to facilitate timely and equitable access to safe blood for transfusion. Damu Sasa itself is an end-to-end blood services information management platform, which is built to aid in the effective management of blood services. It supports blood sourcing, blood donor relationship management, inventory management, transfusion management, and even hemovigilance. It basically adds value at all the stages in the blood services value chain. The various challenges in the ecosystem that Damu Sasa is working to solve include the following: limited visibility leading to unmet transfusion outcomes, and this could further be challenges in blood sourcing, challenges in donor relationship management, challenges in inventory management, challenges in transfusion management. And further, we also have challenges in reporting due to the demanding nature of the reports. And this ends up hindering effective planning of the blood services processes and activities. The Damu Sasa solution has a couple of modules which are built to help solve some of these challenges. And the first module is the donor relationship management module, which allows for targeted donor recruitment. It allows for recalls. It allows for donor education. So we'll have some of the panelists talk about this particular module and how it has been able to help them and the potential they see. We also have a referral management module that allows for blood donor referral to secondary care. It basically ensures that there's no gap between a deferred donation and a referred case to secondary care. So we're able to monitor the entire process. We also have an internal management module that allows, or rather supports, screening of blood and blood products. It also supports inventory management once screening is done, such that you can do such things as blood unit aliquoting when you're dealing with children. You can do component preparation, where you break down from whole blood to other components that may be required. It also supports transfusion management, whereby you're able to monitor the patient's condition or situation even as the transfusion continues. We'll also have some of the panelists talk about this. We also have the inter-hospital collaborations module that allows for real-time blood sourcing amongst hospitals. And this is mostly to reduce the lead time within which hospitals can source for blood from one another, to ensure that we can shorten the time that the patient will get blood for transfusion. We also have a hemovigilance and reporting module, and this basically allows for real-time monitoring and evaluation of the entire blood services value chain, whereby you're able to pick out things such as potential cold chain violations, potential expiries in blood. You're able to also monitor the turnaround time for all the requisitions to actual transfusion. So for example, if it's 60 minutes, according to the hospital transfusion policy, you're able to actually monitor that transfusions do occur within the 60 minutes between requisition and transfusion. Last but not least, we have an e-learning module that mostly supports online continuous medical education for staff. And this has been especially useful in the time of the COVID pandemic, especially given the social distancing requirements. And given the fact that staff can no longer, huddle together in one small room. So now you can actually have access to educational or informative material from the comfort of your home, from the comfort of whichever device you have. And therefore, we've been able to keep CMEs going through this module. With that, I would like to move into the next session. And our first speaker for this next session will be Walter Amusunzu from the Gertrude's Children's Hospital. And he's going to be speaking about blood donor management, which has been quite necessary thing to talk about, especially given the COVID-19 pandemic, where we have issues with the blood donation culture in Kenya, which has led in part to shortages in blood and blood products required for effective treatment outcomes. So without further ado, I would like to invite Walter. Walter, can you hear us?
Yes, yes. Thank you, Aaron.
Go ahead.
Thank you, Aaron. Now for Damu Sasa as an end user, I'm privileged to have used the system a few months back, and I'll talk about just basically donor management, because that is where the big issue is when it comes to blood transfusion and blood donation and the blood culture in Kenya. So basically in Kenya, we basically require nearly 1 million blood units, that is annually, for transfusion. But from this, you can also see that it's around 2% of the population, according to WHO, as in Kenya, who can donate for that 1 million. But unfortunately, our country right now, we have a very bad culture, as that I must say, when it comes to blood donation. So what the system has done is try to improve the donation culture in Kenya. Basically, that is from donor registration, donor donation process until transition to the patient. So this basically, it's a simple way how the system is able to manage our donors in regards to from donation time until transfusion, and then again back to the donor again, giving the right information and right to use. So now, as Gateway's Hospital, when we were doing our donations, let's say donor recruitment, we normally used to have a registry or that was manually populated. But when it came to Damu Sasa, it gave us an opportunity to have our donors registry online, where it can be managed very easily with a click of a button. So what happens is that once the donor arrives, you can easily register them on the app, go straight to donation, monitor the donation ends, and then finish the donation. at the same time after the donation, give the donor a notification that they have already donated this day and their next appointment will be on such a date. So the system easily helps to manage the donor expectations. That is, when are they allowed to donate? When is the right time to donate? Now, I'll talk about basically how Damu Sasa helped us at Gatwick Hospital. So what happened is that we have a system that is able to give donors, let's say, the right information. So for instance, for example, we have a client or a patient who needs urgent blood. For example, let's say, for example, B positive. So with a click of a button, we can easily go to appeals from the system, and you send an appeal, for example, from the system, from the registry, and say, I need like 10 B positives. So what the system is that it sends out an appeal to the number of donors that you want that are eligible to donate at that specific time. So for example, if you say I want 10 B positives and you go to appeals and you click on it. So what the system does is it will automatically send out an appeal to 10 eligible B positive donors, specifically what you require, and tell them that at Gatwick Hospital, we need B positive blood group. Now, what happens when the donor receives this information? The donor is able to schedule a booking. What time are they available on the system? So once the notification is sent, the donor is able now to pick it up. Say, for example, I'll want to donate at 2 p.m. So this information, when the donor clicks OK, accepts it comes back to us, the notification saying that out of the 10 donors, 1 or 2 have accepted, and these are the timelines that they will be showing up for donation. Now, it helps us in management of the donor, since we want the donor to be very comfortable, very convenient at their own time when it comes to donation. So once we have this information that this donor is coming, as you or the person who is at the hospital is able to manage yourself very well, knowing that I have this number of donors, this time is allocated to them. So when they're coming in, you have very minimal time to handle your donor from donation without any interruption. Now, in regards to the, let's say, for example, right now, the COVID pandemic, where we have the issue of social distancing. Now, the system now, when it comes to now the donor management, can easily help you to, let's say, manage your donors or the queuing or the scheduling. So, for example, if your facility can handle up to, let's say, 10 donors per hour, so you don't want all the 10 donors to come to your facility at the same time. So what happens is that you can schedule them at intervals. Let's say after every 30 minutes, you have a donor coming in, donating and leaving. So the system easily helps you to manage your donors' donation and the experience. So it is a way that can help us improve the donation culture in the country, basically by having the right information to most of our donors that usually come to donate. Since, as we know, the donation culture in Kenya, it's not very good. So if the system can easily help handle this process, the donors part, then we are very, very, very much assured that in a few months or a few years to come, we'll have a very good donation culture with this system in place. Now, secondly, how does the donor now get the right information? Now, on the system or on the app, because there's also an app, there's a way we can appreciate our donors. So for example, I'm a donor. So if I donate like today, let's say this is let's say January this year. So I donate up to December, let's say 4 times in a year. So what the system does is try to appreciate me as a donor. So it will be giving me points, scoring me points, just as a way of appreciation to me as a donor, so that I can continue with the culture of donation. So this also helps donors feel that they're appreciated and they're saving life. At the same time, we have a portal there by the same side of the donors, they're given adequate materials. Because for example, right now we have a lot of myths concerning donations. So what the system does is that it has a very educative materials regarding to donation, the safety of donation, and to demystify some of the myths that are outside here that are leading to a poor donation culture in Kenya. So with the education, donor education on the app, it's very much easy for the donor now to just go there, look for anything that probably they had a fear of donation, and get it right from the system. Now, secondly, when it comes now, for example, our facility as Gateways Hospital, we have another type of donors. For example, we have apharetic donors. So this is one of the categories that right now is being introduced to many hospitals, apheresis process. So what the system has done is that for us, we have been able to customize the donation criteria for apheresis. Since now, when it comes to apheretic procedures, we have different requirements we have different requirements when it comes to apheretic procedures. Now, what the system has done is that we can customize us as Gateways. For example, now we want apheretic procedures. So for apheretic donors, we have given them the criteria and what is required per the donation. So for example, if you're doing, let's say, platelets and you want apheretic platelets, so what happens is that you can donate after two weeks. So what the system is that it gives you the right information to the donor. So once I'm donating, this is the timelines I'm supposed to donate. So in this regard, it helps us easily manage the expectation of the donor from the donation time until they are able to donate again. So now, what about, let's say, someone might ask about the safety or assurance. So for the donor, most of the donors usually want to know, where is my blood going to? Now, with this system, you can easily trace. The donor can easily, if they were able to, they want to say a clarification where this my blood going to, they can easily be shown where in the system how the process goes. So the blood is here. You can use from donation until transfusion, how the unit they donated was able to assist a patient until transfusion. So it is easily traceable. So when it comes to the myths out there that blood is being sold, with the system, we are able to eliminate that, since we are able to trace a unit from donation time to transfusion time. So it will really minimize the myths that's also there that most of our donors say that probably blood is being sold. So with the system, we're able now to minimize those chances and give the right information to our donors, so that in the future, someone can come and donate without having the fear that his their blood is probably being sold, which is very one of the major obstacle in the donation culture in Kenya. So with the system, we're able to to manage that when it comes to the donor confidence in donation in any facility. That is probably in regards to guests, that's how we can easily see that.
Hello, Walter.
Yes.
No, your time is almost up.
I'll
give you a minute to wrap up.
Okay.
You have 1 minute to finish.
Okay, thanks, Aaron. So in conclusion, when it comes to the donor management, this is where most challenge is. So with the system, we are able to manage donors' expectations, anxieties, because they are getting the right information. From donation until they finish. Now, for every institution that will want to probably engage more on the services of the system, it's very much easy, very friendly, very effective in donor recruitment, appeals, transfusions, and safety in any institution that is able to manage their donor expectations and any requirements that required for every transfusion and donations to happen. Thank you, Aaron.
Thank you so much, Walter, for that. And we'll have a question and answer session. I'm sure some people will have questions later. Very quickly now, I'd like to move to our next speaker. That will be Mr. Thomas Rotich. And Mr. Thomas Rotich is going to be talking to us on the perspective of interfacility blood sourcing. So, Mr. Thomas Rotich, welcome.
Good evening once more.
Good evening.
I'm going to talk about in the facility blood sourcing. As you are aware, many hospitals do transfusion, and blood sourcing is one of the greatest challenges in the blood service value chain. In this event, more challenges are emerging in situation whereby the blood is unavailable. So if blood is unavailable, it will be very difficult for an hospital source from another hospital. So through the Damu Sasa platform, you will be able to see which hospital has which units which are available, and the other hospital which requires that unit is able to request from the system. So the more the facilities using Damu Sasa platform, it will be very easier for hospital to source blood from different hospitals. The fewer hospital, it will be challenging. Also, we need to have more collaboration between the hospitals that are using the Damu Sasa platform. We find that at times if there is no good collaboration between the various hospitals using the platform, an hospital will be having a unit preserving for its dry season, like for O negative patients. So an hospital might be holding the O negative for maybe hoping that a patient will come. And if there is no good cooperation between the facilities, and another facility might end up losing a patient yet there is a facility which had a O negative, which they could have assisted save that life of another patient in another facility. And also the platform, Damu Sasa platform, helped to reduce the time taken to request for a unit of blood from another facility. If many of the hospitals are in Damu Sasa platform, at least with a click of a button, you are able to source for blood from another facility. And that helps in sourcing blood real time. And it's a good venture if we are able to collect enough blood. As my colleague Walter was saying, we have a very bad culture of donating blood, but with all these efforts being put in place, I hope the culture of not donating blood will change. You can also, while requesting for or sourcing for blood from another facility, I think probably in Nairobi, the Damu Sasa platform has been linked with some guys, border guys, whereby they are able to deliver from a unit of blood from one facility to another facility, which will be reducing time taken. Maybe at times like jams in Nairobi with an ambulance, at times the road is really blocked, and I think the border guys are able to maneuver here and there, and the time for delivery of that unit is reduced. So it is really, while sourcing also, we can be able to see which blood are almost expiring, and that unit or can be released to another hospital which is really in need of that unit, so that it cannot expire on a place. Because when blood expires, it's a waste, and all the efforts have been put in place to collect that blood. The more facilities that are on board on our Damu Sasa platform, it is better for the various hospitals as far as sourcing of blood is concerned, because you cannot compare maybe 2 hospitals and vis-a-vis 10 hospitals who are using that platform. If you are in need of a unit, there is very high chances that you might miss in the 2 hospitals, but with more than 10 hospitals in the platform, it's rare that you might miss that unit that you are looking for. So mine is to request and encourage all the other facilities that are not yet in the platform to join and ensure that we try to save lives as much as possible. Otherwise, thank you very much.
Thank you very much, Mr. Thomas Rotich, for that discussion on the interfacility sourcing. There will be a question and answer session. I'm sure some of the attendees will have questions based on what you've presented. Now I want to move to our next speaker of the day, and his name is Brian Ajigo from the St. Francis Community Hospital. And Brian will be talking to us about intra-facility management. So how Damu Sasa can be leveraged to manage the internal affairs of the hospital with regard to blood services. Mr. Brian Ajigo, please go ahead.
Thank you very much, Mr. Aaron. As I earlier introduced myself, my name is Brian Ajigo, representing St. Francis, and I'm going to talk about intra-facility management of blood. Blood being a commodity, at times commodity management can be very, very critical in any hospital, and more so blood. So one of the challenges in blood service management is as a result of limited visibility of the entire process. You get that because it involves very many cadres, including the doctor who is requesting the blood, the nurses, the lab. So you will get at times it's a process, and it's at times very, very hard for you to gather all this information. And if this management is not well handled, it may lead to unmet transfusion expectation, sometimes not even because blood is not available, and limited visibility has the potential for such things of unseen blood shortages, such as cold chain violation, expiry, transfusion reaction, and even at times may hinder staff productivity. Using the Damu Sasa platform has been quite beneficial and helping to solve some of these challenges. This is because we can now have a real-time visibility of each and every activity in the process. For example, right now we are able to plan for how many blood we use in a month and plan how many bags we use, how many screenings kits we will order and everything, so that we just make sure that there's no shortage, and something like that. So using Damu Sasa has enabled us, and we cannot even we can see all blood requisitions from the clinical area and whether we have enough blood to meet the demands. For example, if we transfuse like 20 pints in a day, and normally we use approximately 10 pints in a day. If the pints go below the 8, we should make an adjustment and know that we are in a deficit, and through that process we are able to save lives. We can see how much blood we have at any given point across the different blood groups and products. This will help us to reduce, this usually help us to reduce the chances of unseen blood shortages. Secondly, the clinical area are able to follow up step by step of how their requests are being serviced, from sample reception, grouping, and cross-matching of the unit. For example, if a doctor requests a blood and it's an emergency and cross-match, the doctor and the nurse are able to see that the sample has been received in the lab, a blood group has been done, and cross-match is going on. Unlike the other way, without used to have problems, and at times it will always be call after call, call after call, call after call. And in addition, when the cross-match is done, the nurse who sent the request is able to receive a text to inform him that this blood is now ready to be picked. And using the same method, we are even able to see our TAT, how we handle our emergency, and adjust according to the plans. Still, with the use of this platform, we are able to even have a real-time access to transfusion processes, where we can tell how the patient is responding to the transfusion at various intervals. For example, if after collection of the sample, we are able to see that this blood the transfusion has started. Because at times we understand we work in a hospital based, so the nurses may be very, very busy. And somebody will come with the blood in a full box and place it there. Maybe wait even over 30 minutes, whereby now the cold chain will be compromised, and we know the effects, and it will be quite dangerous to the patient. So it has helped us to solve such problems. We are also able to monitor each individual blood in real time, meaning that we have now better able to avoid such things like cold chain management, and so as I earlier explained. Last but not least, we are able to do faster and more comprehensive reporting. This is because the platform is able to collect various data points across the entire transfusion process and convert it into report through a simple click of a button. Reporting has been a challenge to us, whereby you have to go up there, look for transfusion reaction, come back. So by using Damu Sasa, it has enabled us to know how many transfusion reactions have we received, what kind of transfusion reaction have we seen for the last this month, what was the cause of that transfusion reaction, and what can we do to improve and to make sure that we don't get such a scenario again. So for us, it has really helped us to manage our data, which was a problem, and I'll encourage even every other hospital to take it, and it will really, really help them. Thank you.
Thank you very much, Brian. I'm really quite a bit more informed, especially given the fact that I do work in Damu, but hearing it from your perspective is also quite eye-opening as well, and challenging for us to try and do our best to also keep improving the service. I now want to move to the next speaker, who will be Dr. Kibet Shikuku from the University of Nairobi, KNH, and is also a hematologist. Now, Dr. Kibet, we've heard from Walter from representing Gertrude's. He's talked about donor management. We've heard from Brian Ajigo, who has talked about intra-facility management and what needs to be done within the facility, especially in terms of managing commodities with respect to blood and blood products. We've also heard from Mr. Rotich from Eldoret, who has talked about interfacility sourcing. And we want to give you this opportunity now to talk about the potentials and you see, from a broader perspective, especially on the hemovigilance space and what we can do to improve, and the opportunities that you see that we can pursue collectively as an ecosystem. Go ahead, Dr. Kibet.
Yeah, thank you, Aaron. Possibly I'll try to share my screen a little, and I hope it's visible to all of us. I'll try to save as much time as possible. As we all know, blood is voluntarily given. You can't actually cost for blood. You can't sell. You can't determine how much you want to give it to someone. So proper management is so important. And especially in a country like Kenya, where blood is such a rare product, we really need to think of methods of managing that blood. And as one of the presenters did mention, if we were to look for 2% of blood, especially from the population that we have, we should be looking for about 1 million units. But in the last 2 years, I think the best we've ever done is about 170 or 200 units. And this is relatively a small amount of blood that has been collected as a country. I remember the KNBTS were giving the impression that they had actually managed to meet about 80% as a target. But again, this may just be a target for KNBTS, but it may not be a national target. And so we have quite a bit to do as a country, and this has gotten complicated certainly by the presence of COVID-19. with relatively minimal support right now from the Ministry of Health. KNH, where I work, apparently requires at least 100 plus units of factor red cells daily. And so you notice that the consumptions per month is in the ranges of thousands of units. And in a country where blood is a problem, you notice that this becomes a big challenge. And I think this is where Damu Sasa became a key partner in trying to resolve some of the problems that we've had. And so donor recalls has always been a big problem, either because of the systems that we use or the lack of the systems that we use. I know a lot of facilities use logbooks or hard material to try and manage donors. And again, this becomes such a big problem, especially if you're looking for specific blood groups, rare blood groups, and it becomes a big challenge. At KNH, I remember I presented in one of the senior management meetings the cost of just preparing 1 unit of blood. And blood apparently to majority of us looks like it's easy to prepare, but it can sometimes range from between 10,000 to 15,000 Kenya shillings. And it gets even more complicated and more expensive if you're dealing with apharetic products, where you can get a unit costing up to 40,000 plus. But again, here we'll be looking at quality. And so the entrance of Damu Sasa has led to us stopping, chasing after blood. And I think if we use this software properly, we should be able to avoid, the many challenges associated with running around looking for blood. And I think majority of us who may be in this forum have experienced these challenges in one way or the other, where you order for blood and you have to keep chasing for it all around because the need is relatively high, but the supply is quite low. And so what are the key areas that we can focus on as benefits when you have Damu Sasa as a software to manage your blood? One is you end up with a registry that allows you to manage your donor information real time. And the reason why this is important is because a lot of donors in many facilities would give you their blood, but then they don't have any method of follow-up. One, either for you to manage their database or for you to even message them. And so Damu Sasa has that capacity to message a donor real time. There is also ease to follow up these donors. I remember that when we started using Damu Sasa, we got some donors, including pilots from KQ, who had some rare blood groups, and they were willing to come and donate. And actually, as we participated in the donation program with them, we realized that when a pilot donates, they don't fly the following day. And so we learned quite a bit as we kept moving along because we were able to recall them and get some information as we continued managing this group of donors. The other thing is you get basic education that enables you to target specific donors. There are donors that you want to give certain pieces of information. And actually it gets better when you are dealing with apharetic donors or donors that give you apharetic products, because now you can call them on a slightly much more closer durations, including up to 2 weeks of recalls. The other thing is with this software, there's a lot of flexibility to access donation centers. You can actually be able to just determine where you want to be bled. Remember, a lot of donors in Kenya are unable to give blood because when you look at the distances involved on where to go and donate, you literally just give up. And then, of course, moving around requires resources. You need money to move around. And so with this app, you can actually be able to look at the closest facility that is of interest to you, and you can go and give your unit there. And that unit can still be mobilized from one facility to the other. So the more sites we engage and have these sites registered, the better for all of us, because then we can share similar information for all donors across the various sites. The second thing that we actually end up enjoying as you work with the Damu Sasa is this real-time interfacility sourcing. And there are 3 options that you have as a user. One is you can be able to request for either blood or blood components between the facilities that you work with. That is one. The second thing is you can actually decide to just throw a request across the pool of facilities that are already registered to use this facility. The other thing is you can also determine or set limits that can be viewed by other similar facilities. For example, I can decide as a facility that I need about 60 units every day. Anything above 60, can be viewed by other facilities. And so you can actually be able to work with the rest of the facilities real time. So any excesses can actually be picked by other facilities that might be needed. And we all know that blood is such a rare product right now as a country. So if you have any excesses, we can all be able to see, and we can be able to share together across board. And by extension, this actually ends up avoiding any unnecessary expirations or minimizes wastage. I know a lot of times you can't be able to see what you have in the system, especially if you're using logbooks and things of that nature. But with the software, you can actually be able to very quickly populate units that may be about to expire or with short expiries. And so by we can be able to share what is about to expire with those that might need it. And of course, even for products that have shorter expiries, we can be able to share with the rest of the team. The other one is you can actually be able to perform real-time hemovigilance. And as we all know, hemovigilance is a set of processes which a lot of times are never followed. And I think when facilities started developing hemovigilance officers, it has not been easy to get real-time information. But with the software, you can actually be able to pick quite a bit of information. You can be able to determine who is having what kind of challenge. You can also be able to determine patients that may be having positive for whichever TTI is of interest. And you can be able to defer this kind of donors, or you can actually be able to refer them appropriately for care. The other thing is you can determine heavy consumers within the facility. Especially if you're dealing with a big facility like in KNH, we can be able to know which wards, what kind of disease entities are consuming what kind of products. And this way you can be able to also compare blood utility within the facility, including the various components that might be required. And so that makes it easier for us to plan for blood consumption and utility within the facility and actually within the country. So this particular software should be able to assist us in managing some of these challenges. So what would be the potential then with adopting Damu Sasa as a blood service manager? One is you get connected to a wide family of blood managers. Remember, there are different facilities that are already enrolled, and these facilities can talk to each other. These facilities can communicate amongst each other. So you have a wide array of facilities that you can communicate with. You have people you can discuss with. There are facilities that manage whole blood while others manage components. And so people can actually discuss and see how to conveniently manage blood across the country. The second one is you can be able to get real data for the various blood components and their utility, either within the facility or as a country. We know that blood, different facilities have been given different capacities to prepare various types and components of blood. But again, we can be able to see the utility of these products, and we can also be able to track any complications associated with this product. The other one is there is also visibility by the National Blood Donor manager, which is KNBTS. KNBTS, from my understanding, as far as Damu Sasa is concerned, has a bigger visibility of all the facilities, and it can actually be able to determine which facility can mobilize what unit from which area to which particular facility that may be need. And so if KNBTS, for example, which is now working very closely with the Damu Sasa, was to look at the database that is available, they can actually be able to move a needy unit from one area to another area. And so by so doing, we can actually be able to conveniently utilize whatever products we have within the country. The other thing that I know is that there is also a possibility that we can have a button in case of national disasters. And this button has been given to very specific individuals. And you can actually appeal for blood. And as we appeal for blood, my hope and assumption is that we can be able to determine where this blood goes, so that then we don't crowd one particular facility with blood. We can be able to mobilize whatever has been donated as an appeal to different facilities for storage and subsequent utility. And so Damu Sasa can actually end up being a solution that we need as a country to manage blood as we work with the National Blood Transfusion Service and of course with the government of Kenya to try and close the challenges that we have in relation to blood and blood components. I think I'll leave mine at that, and then we can possibly share through questions with the rest of the team. Thank you.
Thank you very much, Dr. for that elaborate and comprehensive presentation. I think it sort of ties up all the discussions and presentations made by the different panelists. I take this opportunity to thank you all, the panelists, for those presentations that you made. And now the session that is coming up, we want to have a question and answer session. And I think the first question goes to Walter Amsunzu from Ruben Tulel. And Ruben Tulel would like to have more information about how you process apheresis donors, and more so how that same process can be supported by Damu Sasa. Walter, can you hear us?
Yes, thank you.
Go ahead. Go ahead. Thank you.
Okay. So Ruben, so when it comes to donors, we all know the requirements for general donations. So for apheretic donations, it's slightly different. First, for starters, the minimum weight for an apheretic donor should be, for us at Getus, we take it from 72 kgs. So in a normal donation, we normally do 50 kgs and above for normal donations. But now for apheretic donations, it's normally 72 kgs. So that is one of the criteria. Secondly, we check nearly all the vitals, starting from your temperature, the BP, and then your weight, and then your height. So those are some of the things that basically we look at when we're doing donor recruitment in terms of apheretic donations. So first is the weight, that is a minimum of 72 kgs. That is as per our policies at Cartus Hospital. And then the weight, the height, that is the height, which we normally take a minimum of, let's say, 160, if I say 160 centimeters, meters of this centimeters, yes, 160. So the weight, and then the height, and then you also look at the vitals. And then secondly, we look at the duration. How long can one donate from after your first donation? So if you are doing packed cells, that is packed cells, red blood cells. So the duration still remains, that is 3 months. That if that's the apheretic donor, is 3 months. But when it comes to platelets, if you're doing donation apheretic platelets, so the duration changes to 2 weeks. So now it no longer goes to 3 months as usual, but now 2 weeks. So one donor, if you're doing apheretic platelets, the donor can donate after every 2 weeks. So this information, the system is we're able to feed it in the system so that the donor, when the donor comes, he knows exactly what, if you're doing apheretic platelets, I'm able to donate after every 2 weeks. So you see, from this, it's a bit different from the normal donations. So with apheretic donation, it's usually a bit different. And then secondly, with this one, with the apheretic donations, now we're also looking at the venous access. The venous access, because remember, when you're doing apheretic donation, we are only taking what we want. For example, if you want platelets, so that is what you will give us. So we will not take your blood. We only take platelets. So the venous access has to be very, 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 very visible. So the donor is also checked that, and then the procedure is done. So when it comes to, that's what I was saying, it's a bit different recruitment process, a whole wide, we look at various things before we do apheretic procedures, basically, and then the duration time. So normally for a normal ordinary donation, it will take you less than 10 minutes. You're done. So long as you have a very good donor success, you can donate in less than 10 minutes and you're done. But now when it comes to apharetic donation, the duration changes a bit. So the minimum you can do for, let's say, platelets donation in apharetic, it's a minimum of 1 hour. So that's the minimum. Those people who do less than 1 hour, but the minimum usually 1 hour. So when you're doing the recruitment, you have the donor has to know all this information, that from start to finish, you're going to take a minimum of 1 hour. Secondly, so we talked about the weight, the height, and the vitals. That is the blood pressure and all other requirements. So second, now we go to the pre-platelets or pre-count or a pre called full blood count. So what are we interested here? We want to know, are you as a donor, do you have the right qualifications to donate? So for example, if you are doing I'll take just one product. Let's say you want apharetic platelets. So the minimum requirement for you to donate apharetic platelets, you must have at least 250 minimum pre-platelet count for you to be able to donate. So on top of the other requirements, also the platelet count, that is the full hemogram is usually done first to determine whether you qualify for apharetic procedures. So remember, basically, why we're doing this is because all this information is usually fed into an apharetic machine. So the apharetic machine now gives you the duration in regards to your weight, height, and then your platelet count. So those are some of the things you look for when you're doing a donor recruitment in terms of apharetic procedures. So any other question? Aaron?
Thank you very much, Walter. I just have one more question for you, then we can move to the next panelist. And this question is from Dorothy, and she's asking, can someone donate packed red blood cells, then before the next donation, donate platelets only? I hope you understand that question.
Yes.
Can someone donate packed red blood cells, then before time for the next donation, donate platelets only?
Now, yes, I understand that. So now, Dorothy, now for you to donate platelets, all the other requirements must be fulfilled. For example, if you have donated packed cells, so your next appointment should be basically 3 months. So you can't donate in less than 3 months. So that means that you'll be putting your body at more strain, because you see you've not achieved the duration that is specified for you to donate again. So if you have donated packed cells, you need at least to have given your body enough time to recover, because basically, remember, with the apharetic procedure, it's a bit vigorous, because remember, you're staying in a machine for nearly 1 hour. So if at any time your body is not able to withstand that process, you might not be able to finish the whole procedure to the end. So you need to at least adhere to the protocols of donations. That is, if you've donated packed cells, for the first time, you need to at least for men at least 3 months, for women at least 4 months. Then you can now donate let's say platelets again. But before you even donate platelets, we usually look at the things I've said, your weight, height, and then your pre-platelet count. I hope I've answered that.
Yes, thank you very much. And now,
can I make a comment?
Yes, please go ahead, Dr.
You allowed? Yeah, so I know that is a very tricky question. I don't think it's it's an easy question to answer, and I think my colleague has really tried, Walter has really tried to give an answer. I guess the challenge is when we start talking about apheresis. Apheresis is highly specialized, and it looks for, you specifically harvest what is of interest to you. If you are picking packed red blood cells, the protocol demands that you do this every 3 months. But my assumption is that you can only repeat another packed red cell harvesting after 3 months. The question was, can you donate platelets in 2 weeks? Remember, with apheresis, you don't collect platelets if your interest was packed red cells. So if we were to theorize, then I think it is possible. Question is, has it been done? I think for me it is a hard answer to give. But if it is very necessary, I guess from an emergency perspective, I guess it is something that is worth looking at. And if you fulfill the criteria that is required before you apherese, I think it is something that possibly is possible if it is on an emergency basis. But of course, the normal recommendation is to wait for the appropriate time. I think that's my small contribution.
Thank you, Dr.
Thank you very much. I have now one question for Mr. Thomas Rotich, can help us. And the question is, if I get a tattoo today, how long do I have to wait to donate if at all I can? So can I donate when I have a tattoo? Mr. Thomas Rotich, can you hear us? Hello, Thomas Rotich. Okay, as we wait for Mr. Thomas Rotich, in the interest of time, Brian Ajigo, are you able to take that question? Brian Ajigo?
Hello?
Yes, we can hear you. So the question is, can I donate if I have a tattoo?
Yes, you can donate if you have a tattoo, provided the tattoo has healed. And in the other places, like the place that I'm working, you'll have to wait for 1 year. Because the previous culture was, the method of tattooing that was being used was not sterile. But currently, with the method of tattoos, we have a sterile method. So provided the limit has healed, we'll give you the self up 1 year for you to donate, provided again, the tattoo is not on the phlebotomy site. Are you clear?
Yes, thank you. And that was a question by Maya, and I hope she got that. Maya Khan got that correctly. Now, I also have. Yes, go ahead, Brian.
Kindly, I'll like to add, in addition to that tattoo, you will have to meet all the other criteria for donation.
Thank you very much.
Thank you.
Mr. Thomas Rotich, are you back with us?
Yes, I am. Thank you.
Oh, thank you very much. I have one question from Barmasai. First and foremost, how is the Damu Sasa infrastructure at MTRH? I guess that's Moi Teaching and Referral Hospital. And has it been merged with the Eldoret RBTC, Eldoret Regional Blood Transfusion Center? Go ahead, Mr.
Okay. Damu Sasa platform is up and running in MTRH for now. They have been, I think they went live around, they are around 2 months now. We have not yet merged with RBTC Eldoret, but I think in the near future it's going to be merged. Thank you.
Thank you very much, Mr. Thomas Rotich. And I can't see any other questions. That was the last one, actually. So I'm going to give this opportunity now, in the interest of time, for all the panelists to have last shots, last bites. And I will start with Mr. Walter Msunzu. Please, one last parting shot. You have 2 minutes.
Thank you, Aaron. So I think basically with the Damu Sasa app, we are able to improve our donation culture in Kenya. If all stakeholders will probably come on board, assist where possible, spread the word about the system, this can easily change our donation culture and help most hospitals in terms of donor management, blood units management, in every aspect. Because considering that, for example, you have a client for a patient coming from all the way from the Garissa, coming to Nairobi, then they're told, can you look for donors? So you can imagine these clients or these patients already is stressed about her condition. Then you tell them to look for donors. So if we can manage this system very well, it will be very much beneficial to most patients, because with a click of a button, you can easily get blood anytime you need, and you can easily trace it back to the donor and the patient. So I think it's a high time that the institution come up on board, and we at least try and encourage a good donation culture in Kenya. Thank you, Aaron.
Thank you very much, Mr. Walter Msunzu. Mr. Brian Ajigo, you have 2 minutes for one last parting shot to the attendees. Go ahead, please.
Okay, thank you very much, Mr. Aaron. For me, Damu Sasa is really a good thing, and in the near future, maybe 1 year, we'll see its fruit as many donors will be introduced and they'll have that culture. For the facility, it will be even good because we'll be able, if we have donors, then it means we can save as many lives as possible, and even include even massive transfusions with no problem at all. So for me, we are heading in a good place. Let me say that.
Thank you very much, Mr. Brian Ajigo. I want to move to Mr. Thomas Rotich. Your parting shot, please go ahead. You have 2 minutes. Mr. Thomas Rotich, yeah, go ahead. Sorry.
Well, I think more effort should be put on efforts to ensure that we collect enough adequate blood. Damu Sasa platform is like in MTRH, when nurses are now ordering for blood and you don't have that blood, with them they have ordered. And as maybe BTU needs to ensure that all those orders are acted upon, and they cannot be acted upon if we don't have enough blood. So if more efforts are put in place, or more stakeholders can come in place and ensure that we collect enough blood from voluntarily non-enumerated donors, then it will be a plus all of us. Secondly, recalling of donors. Damu Sasa platform has a platform whereby we saw you recalling donors during Valentine's Valentine's donation exercise. During that time, I was one of them donated, and I remember I got a message whereby a thank you message and next time that I'm going to donate blood. So if that can really capture all our donors and so that they can be encouraged and motivated to come next time after 3 months to come and donate. Thirdly and last is retaining our regular donors. It has become very difficult for maybe retaining the regular donors, as what one of our panelists had said about we have been accused of selling blood, and guys who used to be regular donors are shying away. So we need to put more efforts also to ensure that the regular donors that we have are retained so that they can remain in a pool whereby they will be donating regularly. Otherwise, thank you very much and enjoy your evening.
Thank you very much, Mr. Rotich. I now want to move to Dr. Kibet. Your parting shot, please. You have 2 minutes.
Yeah, thank you. Mine is very brief. There is no better way of thanking someone for saving a life by donating. But this has only been possible through Damu Sasa. And I think as professionals, we should up our game so that we manage our blood and blood requirements more efficiently by using software that makes it easier for all of us. So mine is to encourage all of us to try and adopt this methodology and software, which has some free modules. So all of us can actually be connected. I'll leave it at that. Thank you.
Thank you very much, Dr. Kibet. And on my part now, I want to extend my sincere gratitude, first and foremost, to the attendees of this webinar. I really appreciate that you found the time to come and listen to some of the experiences from some of the professionals in the space. We do not take that lightly. We really and highly appreciate it. Number two, I extend my appreciation to the Kenyatta National Hospital for helping us organize this webinar. It has actually taken quite a lot of planning, and we're happy that it finally came to pass. We highly, highly appreciate them for making this happen. I now also want to thank my fellow panelists for also as well making the time to actually come and share your experiences despite your busy schedules, given that you're in the medical field. We also appreciate that, and we value the feedback that has been given. And it's also a challenge to us to do more to improve. As well, it's quite amazing on our part to hear feedback from the other side, because to get Damu Sasa to where it is today, it has actually taken feedback from the different hospital teams. This is the nurses, the doctors, the lab teams, the ICT teams, to actually sort of customize the system to ensure that it actually does meet the needs of all the different hospital teams on the ground. So for that, I want to say thank you very much. In closing, I would like to share a very brief video with all of you so that you better understand what Damu Sasa is. So I will play the video right now just for you to better understand some of the things that Damu Sasa does. I hope you enjoy.
Did you know that 1 unit of blood can save many lives? By donating blood, you save the life of a mother in the delivery room, the life of a newborn baby, the life of a person with cancer, and the lives of many others. Did you know that donating blood is also good for your health? Health experts say that donating blood helps reduce the risk of cancer, among other health benefits. By donating blood, you get to know your blood group, better prepared in case you too are in the need of blood. Our mission at Damu Sasa is to walk this journey with you. When you register with Damu Sasa, you open a world of opportunities to become a champion by saving the lives of others. You will receive regular updates on where and when you can donate blood. Damu Sasa, we appreciate our champions in the best way we know how. you receive information relating to your donation, such as your blood group, directly to your phone, as well as real-time access to your donation history. In addition, you get access to a wide range of health tips, such as recommended diets, exercise, and new related developments in the health space. Damu Sasa also gives you a chance to meet, join, and interact with like-minded individuals keen on saving lives and maintaining their health through blood donation. By joining Damu Sasa, you will save lives, including yours. Donating blood is a noble calling. Become a Damu Sasa champion today.
Thank you very much. I hope that was visible to everyone. Once again, I would like to say thank you to all the participants and all the attendees. And I also want to inform you that in case you have any further questions that may not have been captured in this particular session, please feel free to check out the Damu Sasa website, and we'll be able to interact with you through our email addresses that are currently on the site. We also have the YouTube page where we upload various videos every month, and these are mostly educative videos. We hope that you'll have access to them, and that you will enjoy them, and that most importantly, they will inspire you to act, to go and donate blood so that we can work together to save patients. I take this opportunity now to throw it back to the KNH team. Thank you very much. And please do have yourselves a wonderful rest of the evening. Thank you very much.
Hello.